There are renewed COVID fears in China, and what does it mean for a country like India and the companies associated with it? To discuss this, joining us on the show at BQ Prime is Dr. Arvind Lal, Chairman and MD at Dr. Lal PathLabs, joining in. Welcome to the show, Dr. Arvind. My first question coming to you is your first reaction with regards to the resurgence of COVID in China.
So, Hiruth, first of all, thanks for getting me over on the show. And as far as COVID in China is concerned, I think it's now a very well-known fact that China has not been able to develop the proper immunity in its people, primarily because of two reasons. One was an unnecessary lockdown, which could have been opened earlier. And the second was that the dearth of vaccination, especially amongst the elderly people in China, so which resulted in higher number of hospitalizations. And as we are speaking, well, there are reports, unconfirmed, of course, that there are about 1 million cases a day in China.
Yeah.
And so we wish them well. And the second thing is that the two Omicron subsets and subvariants which they are seeing in China, which are basically the XBB and the BF7 variant, have already been in India earlier. So the good thing about these two variants is that they are not causing that much of mortality, but yes, they can cause some kind of a morbidity, and especially amongst the elderly people. And the Chinese people have, because they were not exposed to all the things which we have been exposed to the rest of the world, well, they lack what we call herd immunity. And I think that's one of the reasons why it has, resurged again, in China.
Yeah.
So that's the Chinese take. But as far as India is concerned, I must inform you and your viewers that right now we are undergoing a triple whammy. And it's a triple endemic attack, or triple demic, as we call it, which has these, variants of COVID-19, which I've discussed, and also influenza and the respiratory syncytial virus called as RSV. The point to be noted here is that as far as the human body is concerned, well, these are all the same family of, viruses, and a 5-degree drop in temperature. And I'm emphasizing on this because Delhi temperature reached 5.3 yesterday. So if you come down from 10 to 5, well, the nasal immune system, is down by 50%.
Wow.
And one of the good things how you can protect yourself more is by wearing a mask which keeps the nasal passage warm, like a person wearing a sweater. So it's a nasal sweater. So this is something new which has come in, and people are advised not to go to crowded areas, crowded places, especially the elderly, and to take precautions with masks wherever they can go.
Right. So, that's good amount of information as well as to how someone should be taking care of themselves in the country. So, are you seeing that, if this variant travels to India, what happens then? And I mean, are we seeing a trend emerge with regards to COVID tests again?
The COVID tests have not increased significantly, I would say. It is because of the news that, that China may, the viruses may come from China. But as I had mentioned earlier, Hirul, that these viruses were very much present in India.
Correct.
So, yes, because of the triple whammy, which I just discussed with you, well, there is now going to be slightly more amount of testing because, people don't know whether it is COVID, whether it's influenza, whether it's, RSV. But from our point of view, it is not, statistically significant right now.
Right. And overall, how well prepared are we as a country, in case the number of cases increase?
Well, India has gone through, a very bad phase, if you remember, last April,
Right.
May, when the second wave or the Delta wave was there. And since then, I think we have come a long way. And I thank the government and all the private, hospital owners. So we have now enough beds, we have enough oxygen, we have enough oxygen concentrators, we have PPEs, we have now tests which have been developed. And last but not the least, the the vaccination, which has helped all of us, you, me, everybody here in India, develop a herd immunity, especially if it was accompanied by getting infected also. And the other good news is that the Indian companies, which are known to be the factories for all the drugs in the world, and there's a company by the name of Hetero Group, which is based in Hyderabad. They have
Mm.
launched the generic version of Paxlovid, which is the Pfizer's oral tablet pill, at a very cheap rate, about 4,999 rupees for a course of 30 tablets. So hopefully, none of us would require this, but if required, well, the Indian companies have again come up to this expectation now, and it is, I believe, the launch is imminent in the next 3 or 4 days. So that's also a good news. Hopefully, we do not require that medicine.
Absolutely. Hopefully not. But overall, the medical field is such that you don't want to talk about the positives of it, because that's something which is negative from a human perspective. But that's the fact of the matter. Mr. Lal, another question that I wanted to ask you was overall from a business perspective as well. We have witnessed strong trajectory in the non-COVID business. In fact, we have been one of the first companies to bounce back as well post-COVID, right? So, what's the outlook looking like from here on? Because clearly there has been focus on driving volumes while maintaining prices. There is tactical penetration that we're looking at in the West and the South as well through a modular cluster approach. So, how is that strategy panning out?
So the strategy, as I mentioned in my last interview with you also, is that we have pretty much reached the pre-COVID kind of a
Hmm.
level, and we are going along pretty well after that. So all I would like to add here is that yes, that there is an uncertainty of COVID might bounce back, could bounce back, etc., etc., but it has not bounced back right now. So we people have gone according to our earlier plans, which is to take care of all our patients who were neglected during the COVID times, and especially people who suffered from the non-communicable diseases like diabetes, like hypertension, like cardiac ailments, like cancer, liver, kidney, kidney transplants. Everybody suffered. So those patients are back and they are being looked after. And as far as Dr. Lal PathLabs is concerned, well, this is a pan-India operation. We have now 277 labs, 5,000
Mm,
collection centers, and 10,000 pickup points. And last year we tested about 2.75 crore patients.
mm.
So we are trudging along quite well. Thank you.
Right. And with this kind of an outlook, I mean, our position is pretty strong when it comes to the northern market, right? And recently, you had the Delhi government which announced free medical tests from 1st January. How big an impact will that be to business?
So the first of all, I congratulate the government of Delhi. As you know, health is a state subject, and for having realized the importance of testing. And it is again reiterating it once more that laboratory tests are responsible for 70% of the clinical decisions which are taken in the healthcare field. So what
Mm,
I'm trying to emphasize is that yes, it's a very good thing, very good initiative by Delhi government, and especially for the urban poor. And the urban poor is a very large number of people now, both in Mumbai and Delhi and many other tier one towns. So it's something which should be absolutely be welcomed. But I also would like to emphasize that the poor man earlier, who's at the bottom of the pyramid, was going nowhere, because even if he would take his child or who was suffering from fever, well, they used to be available what we used to call a gunshot therapy, which consisted of the private practitioner and many times quacks giving crocin, chloroquine, chloromycin, cortisone, and cold compresses. So all that hopefully will disappear now or will come down, with the Delhi government taking initiative in trying to upgrade the testing. And and also I would like to emphasize that the government of India's the policy during testing during COVID was test, track, and treat. So what came first?
mm,
Testing. So again, that is a very, very welcome decision. And I hope and pray that this adds significantly to better healthcare in Delhi and surroundings.
Right. Do you think there will be any impact in terms of business, in terms of volume specifically?
Uh, Himal, no, it should not impact us at all because they are serving what you call at the bottom of the pyramid, these patients, and we are in a different segment altogether. Well,
Okay.
if the people in Delhi are not happy with private, labs, etc., only then the thought will come of going to a government thing. But by and large, this is a different segment, and this is a different tier altogether, very much akin to the Indian Railways, running its train from point A to point B. But the lowest charges are for the unreserved, second class, and then are followed by the three-tier AC, two-tier AC, then the AC sleeper, chair car, etc., and finally the first AC. So I think this is the thing has become more, segmentalized. So our segment is completely different, and in fact, we have seen from our previous, experience. We are a 73-year-old company. That when people have come here, that whenever competition has come in, it has actually increased our business. So it
Mhm.
not only increases the piece of cake, but increases the entire size of the cake also. And we will also be benefited by follow-up testing because I'm sure Delhi government will find out many things which were hitherto never found out. And this will also give us an opportunity for further testing and for high-end testing. So we look quite, favorably to it.
Right. And overall, with regards to Swasthfit as well, the performance has been strong. The contribution to revenues has been increasing as well. What's the strategy with Swasthfit from here on?
So the Swasth Fit, as you know, is a preventive and wellness kind of a
Mm.
package. And as I told you, that the non-communicable diseases or the lifestyle diseases which are taking 65% toll of our population, they cannot be controlled by people not getting themselves tested. So that's
Mm.
point number one. So we're going to step on that. We are also improving the patient's experience when they come to us, and don't forget that we were the first labs in the country which went into IT way back in 1986. And we have the finest of the apps, available for a long time, many years now. So all that has been, cleaned up. We are going to the next generation. And also that, we have got very, very high segments of pathology testing. For example, many people don't know that Dr. Lal PathLabs is the number one biopsy testing service, histopathology service in the world. We test 1,400 biopsies a day, and we are the biggest,
Mm.
kidney biopsy center in the world. And we
Mm.
have the only ones in this part of the globe to have an electron microscope in private practice. And by the way, we've placed an order for the second one. And in addition to all these kind of, high-end tests, we have also established over the last few years the cancer genetic testing, which we call Gene Evolve. It has been, this is in our, in our center of excellence. And also another thing which we call as LACE, which is for autoimmune diseases testing. And also the latest one is LCORD, which is Center for Reproductive Diagnostics. So I think we are way ahead of what we thought we would be. And
Mm.
I look forward to these high-ended tests and our getting more deeper into different geographies now being a pan-India company.
Right. And that's great news to hear that a company from India who's really getting into such advanced technologies ahead of time, which is great. And with this, from a growth perspective, Mr. Lal, clearly we've seen, good penetration coming in the north. In terms of Western penetration, we've recently acquired the Suburban brand as well. Now, coming to the southern market, any inorganic growth opportunities that we're seeing?
So yes, that is a very nice question which you've asked me. It has so we are doing very well in the in say NCR in north of India, central India, and East India, West India now, and so the southern market is well, we are I mean having a look, and I'm sure these things, as they take time. So I'm sure it will happen. but the southern market has not escaped our notice so far.
Right. So overall, from a southern market perspective, any strategy that is already in place in terms of growth?
So you'd be happy to know that we are running, 4 reference labs. Reference labs are those where we can do every test under the sky. So the first one we started in Delhi. The second one was started in Kolkata many years ago. The third one has been functional in Bangalore for quite some time. And the fourth one in Mumbai, we are inaugurating in the next few days, the first week of January. So we are a service or pathology service which is full stack. So there is right from the lowest or the I would say the most primitive test to the highest available for kidney transplants and heart, etc. So they're all available with us. So this will make our penetration into all the 4 north, south, east, west much more significant now.
Right. And very lastly, overall, from a growth perspective, do you expect FY24 as a year to be better than FY23? Or do you think 23 will be good as well?
So I have a feeling that there's bright prospects for us in the next year, and 23 we will already achieve what we have promised. And I have a feeling that now with more people, as I said, I made a point to you that competition has always been good for us. So hopefully we ourselves, we are our biggest competitors, as you know, and with other people coming in, I think we should do very well.
Absolutely. And looking forward to that as well, Dr. Lal. Thank you so much for joining us on the show. It's always a pleasure to speak to you and get a lot of insights from you away from business as well, which really helps. Thank you. Stay safe, and wishing you and the viewers a happy new year in advance.
Thank you very much, and Happy New Year to you. Thank you very much.